Hello, viewers and listeners. You are welcome to another edition of the program, Midday Vibes. Coming your way from Caliphate TV on Star Times Channel 141 and Caliphate Radio transmitting on 91.9. I am Hajara Usman At-Tajri, your uncle for the show. Harmattan is a season that is related to many diseases and infections. Conjunctivitis is one of them. Its condition is marked by redness, itchiness, and watery eyes. In today's edition of the program, we are going to discuss about conjunctivitis. What are the causes? Preventive measures of conjunctivitis. With me in the studio is Dr. Amir Abubakar Abdullahi from the Department of Ophthalmology, Usman Danfodio University Teaching Hospital, Sokoto. You are welcome to the program, sir.
You're welcome. Thank you.
Dr. Amiru, can you explain to our viewers and listeners what is this conjunctivitis?
Okay. Thank you very much for inviting me to this for this program. As she rightly mentioned, my name is Dr. Amir Abubakar Abdullahi. I'm a resident from Ophthalmology Department of Usman Danfodio University Teaching Hospital, Sokoto. I'm here to discuss on conjunctivitis. Conjunctivitis in a layman term means inflammation of the conjunctiva. So if you look at the human eye, the eyeball, you could see a black central part and then the peripheral white part of the eye. So on the white part of the eye, there is a tissue, a transparent tissue on it called conjunctiva. And it's the same structure, it's the same tissue that folds on the back of the eyelids to form palpebral conjunctiva. So once this tissue get inflamed, it's called conjunctivitis. Thank you.
Okay, thank you, Dr. Amiru. So what are the causes of this conjunctivitis?
Okay, the causes of conjunctivitis, it depends on it could be infectious or non-infectious causes broadly. So the infectious causes means that the conjunctivitis is caused by microorganisms, which could be viruses called viral conjunctivitis, or bacteria, making it bacterial conjunctivitis. Or the cause can be non-infectious, mainly allergic conjunctivitis, which occurs due to overreaction of the body to environmental substances like smoke, like dust, and others.
So how can this conjunctivitis, how can it be prevented?
Okay, it's just as I highlighted earlier, the cause of the conjunctivitis, the prevention depends on the cause. If we are talking about allergic conjunctivitis, which of course we said is of non-infectious etiology or origin, that one is part of you. It's not something you can prevent. It's just part of you. Once you inherit, once you have the tendency to develop it, you develop it. Once you are exposed to that substance that triggers it in you. Then for the infectious one, that's bacterial or viral conjunctivitis. Of course, those ones, you can prevent them, one, by ensuring good environmental hygiene, because that's that should be at the forefront. Then you should also ensure good personal hygiene, general hygiene. Also,
washing our hands. Or
washing of hands is one of it. You also avoid shaking hands with people that have active inflammation, especially the infectious type, because it is contagious, meaning that it can be contracted by other people, either through handshake or through indirect contact.
So what are the common symptoms of this conjunctivitis?
Okay, generally, just as I said, conjunctivitis is inflammation of the conjunctiva. Of course, in inflammation, what you see is redness of the that tissue that get inflamed. It's just like any other part of the body. Once it is inflamed, it becomes red. And then pain is part of it. You can be feeling some pains in the eye. Then the eye can be tearing. which is also a symptom of it. Then sometimes some people will have like photophobia, what we call photophobia, a layman term, dislike for light. That if there is light in an environment, you tend to close your eyes to limit the amount of light that gets into your eye. And then for allergic type, itching is one of, in fact, in allergic conjunctivitis, most of the times their presentation is mainly itching and redness for allergic type. And then some of the presentations also include dysentery, which could be thick discharge from the eye. And then in severe cases, just as I said, in severe cases of allergic conjunctivitis, some people they will have redness, they will have darkening of the area around the eye, and then some can also will have their lashes lost along the way, and then some of them will have like whitening of the eyelashes.
You've mentioned earlier that conjunctivitis is contagious, right?
Yes, yes.
So how can people prevent it?
Okay, I said as I highlighted earlier, I said conjunctivitis, especially the infectious type.
Yes.
Where microorganisms are implicated, is highly contagious because it can be transmitted from one person to another person, either through handshakes or through direct contact. So the way to prevent it, it could be the spread could be direct spread, probably somebody having active bacterial conjunctivitis touching his eye and now directly using that same hand to touch the eye of this of the fellow person. Then it could be indirect, such that somebody with bacterial conjunctivitis touching his eye and then ended up touching a surface which another person, otherwise healthy individual, if in contact with the same surface and then accidentally gets his hand back to his eyes, he could contract it. So those are the ways it can spread.
Okay. So you've mentioned that there are varieties of conjunctivitis, right? If I'm not mistaken.
Yes,
so
yes.
What's the difference between viral conjunctivitis and bacterial conjunctivitis?
Okay.
And how can they both be treated?
Okay. Viral conjunctivitis and bacterial conjunctivitis, medically, there are ways we can actually differentiate between the two, though it's mainly from the symptom that patient presented with, and also the examination, the assessment made by the attending doctor. So some of them include, if we look at the etiology itself, as I said, viral conjunctivitis, as the name implies, the cause of the conjunctivitis is virus. And then for bacterial conjunctivitis, the cause is bacteria. And then if we look at the symptoms, usually for viral conjunctivitis, the symptoms they are not severe. If you compare it to bacterial conjunctivitis, they are not severe as that of bacterial conjunctivitis.
But are they similar?
Well, they are just as I said, they are similar, but the presentation and also the doctor attending the patient after assessment will now inform the likely diagnosis of being either of viral origin or bacterial origin. Then another thing is, if we look at it, both viral conjunctivitis and bacterial conjunctivitis, they present with discharge. But in viral conjunctivitis, usually the discharge is watery and sometimes it could be mucoid. But in bacterial conjunctivitis, the discharge could be mucopurulent and sometimes it can be purulent, depending on the type of the organism, the type of bacteria that cause that bacterial conjunctivitis. Then if we also look at the timing, viral conjunctivitis is usually observed or seen during rainy seasons, and the keratoconjunctivitis caused by adenovirus, which we popularly call Apollo, which is known as Apollo. Yes. So it's actually a viral infection. Then for the bacterial infection, you see, usually is seen during dry season. I think those are the things that we use to actually see which one is which.
So what are the treatments for the bacterial and the viral conjunctivitis?
Okay, if we look at the treatment of bacterial conjunctivitis and viral we can look at it in two ways. We can look at it as like general approach, then specific treatment for each of them. Generally, just as we said earlier, generally they present with some symptom of some discomfort. So if you look at it, you want to make patient feel comfortable in addition to giving him specific treatment for the organism or for the microorganism that you think is implicated. So sometimes we do sometimes you limit. What we usually advocate is that you should limit handshake with people. Is one of it. And then photophobia, that dislike for light I said they have, you can use like dark or sunglasses so that the amount of light that is getting into at least is limited, and you have some level of comfort. Then if we look at the that's for general approach. Then for specific treatment, of course, treatment for viral infection is different from the bacterial infection. So if you are treating bacterial infection, you use antibacterial medications. And if you are treating viral conjunctivitis, even though it's usually self-limiting, those ones, once you institute those supportive treatment I mentioned earlier, or general approach, most of them within 1 to 2 weeks is the symptom resolved. It's self-limiting. Most of the time, it doesn't need any specific treatment. Thank you.
So conjunctivitis lead to a serious eye problem or vision loss?
Of course, conjunctivitis can lead to a serious eye problem. Then, if you have allergic conjunctivitis, especially if left untreated, or if you have conjunctivitis generally, especially the infectious type, if left untreated, it can lead to corneal ulceration. This glass part of the black part of the eye, what you are seeing is black, but before it there is a glass, a very transparent structure. So that's why you're able to see that black, because it's highly transparent. So when you leave it untreated, the microorganisms can go and affect the cornea, that glass part of the eye. It can affect it, create a wound on it, and if that wound is not treated, it can perforate the eye and even cause inflammation of the whole eye, and then you lose the eye. And sometimes if it is treated, even if it is treated, sometimes once the corneal ulceration set in, especially if it is a deep ulceration, even if treated, it leaves you with scar. It leaves that glass part of the eye with scar. So vision loss, of course, you have the eye saved, but the vision is lost.
So is there any home remedy or self-medication or self-measures that someone can do that can help alleviate the symptoms?
Okay, generally for infectious type of conjunctivitis, we usually advocate that once a person notices these symptoms we mentioned, he should run to the hospital, because they are not things that you manage at home. But for allergic conjunctivitis, the non-infectious type, of course, you can do some cool compresses because of the itching, and it also help you to have relief of those symptoms. So use cool compresses. What you do is that once you notice or once you start to experience such itching, that itching from allergic conjunctivitis, you can get a clean cloth with a small piece of an ice block, wrap it in it, and be put it on your eye for as long as you can tolerate. You do it on one eye, and then you move to the other eye, and you can do it as frequent as you can in a day. It really helps before you reach hospital.
So how long does it take for conjunctivitis to be completely treated?
Okay, generally, as I said, like some of the conjunctivitis, especially the viral type, is self-limiting. Once you institute the general measures, and then wait for for a time, it's usually resolved on its own. But if you look at it generally, 1 to 2 weeks with treatment, proper treatment, the symptoms usually cease, and then you have some relief.
How can conjunctivitis be prevented from recurring?
Okay. First thing you do is that, if you have active infection, make sure it is properly treated. Because if it has not been treated properly, there is high tendency. Okay, because what we are doing, most of us, what we are doing is that once doctor prescribe a medication for us and we start to get better, we just keep the medications. We don't use it for the time that we ask to use it. I mean, for as long as we ask to use it. So in that case, the infection can come back, and then probably if that infection comes this time around, it will even be worse than the first episode, which is a problem.
And that's what I wanted to ask you. Are there any long-time effects if a person starts the medication or start the treatment and along the way he stops when he or she is feeling better? Is there any long-term effect of the conjunctivitis on the patient?
Of course, just as I highlighted, if you have not used the medication for the specified period, given by the doctor, you may have recurrence. And if you have recurrence, the current problem may even be worse than the initial one, and you start battling with, how to take care of it. Probably that medication at that time that you were using and gave you some relief before may not even work now for you. And then those problems I mentioned before, corneal ulceration, if left untreated, it can perforate the eye and then you lose the whole eye. Or even if it is treated, it may leave you with scar and you have vision loss from that scarring of the glass part of the eye.
Okay, thank you very much, Dr. Amiru. Okay, listeners and viewers, it's still your show, Midday Vibes, coming your way from Caliphate TV on Star Times Channel 141 and Caliphate Radio transmitting on 91.9. We will take a short break and we will be right back. Please stay tuned. Welcome back. In case if you just join us, this is Midday Vibes, coming your way from Caliphate TV on Star Times Channel 141 and Caliphate Radio transmitting on 91.9. And right here at the studio is Dr. Amir Abubakar Abdullahi from the Department of Ophthalmology, Usman Danfodio University Teaching Hospital, Udut. And we are discussing about conjunctivitis, also known as pink eye. You want to be part of this conversation, the number to call is 090-6000-2022. Dr. Amiru, welcome back.
Thank you very much.
So, can conjunctivitis be a sign of underlying condition? If so, what are they?
Okay. Conjunctivitis, especially the non-infectious type, in other words, allergic conjunctivitis, of course, it could be a sign of other conditions like atopy, like asthma. They are all it could be a sign of either of them.
So, what's the best way to manage conjunctivitis in children and infants?
Okay, the management of conjunctivitis generally, just as we emphasized during the previous discussion, is start with home, and then there's some peculiarity in children, such that children, especially the younger ones, is usually the parent. They don't complain, they don't tell. It's the parent that will get to know and identify their problem. So most of the home, or most of the initial management, that is, the home management that is done, is usually done by a parent. So for grown-up children, what should be done at home is that the parent should discourage them from mingling closely with their fellow children, with the fellow children, so that they will not contract it. So So I think those are the things that parents, they should put eye on them, make sure that they should make sure that the children are always kept tidy and clean. They should also be cleaning their faces for them, and then more importantly, take them to hospital for proper treatment by the doctor after assessment.
So are there any special consideration for those children and infants from the adults?
Okay. The only consideration I will say is that if when they come and we diagnose them, for adults we teach them how to use medication, but for children, of course, because they are young, they cannot do it for themselves. It's the parent that will do it for them. I think basically that's the consideration for the children, and that, you know, the children, their immune system, that's why we always encourage mothers, we always advise them not to, play with their medication, because children, their immune system is weak. So any small infection, any small, problem within a short period, it can translate to a big problem. So we always advise them, we counsel them that they should adhere to the medications given to their children. They should put it for the time specified, and how how they are taught to also apply it, which we do at the hospital, because we teach them how to use it practically. We apply the medications. We also tell them what to do after application of the medication. So those are the things we do. But for adults, of course, you talk to them directly. You also do the same for them. The only difference is that for children, of course, it's the parent that you counsel, the parent that you teach how to do it. For adults, you teach them
So there
how
are
to do it by
some
themselves.
parents that, like mothers,
Yes.
they usually relate teething problems with eye problem. Like, can conjunctivitis lead to can teething problems lead to conjunctivitis?
Well, the
Because
way I
some mothers,
understand,
once their children are battling with teething problems, and they will see, like, is it cancer that the people call it,
cancer,
then they will
that's
just conclude,
discharge.
yes, the eye is paining them, but just say it's part of the teething problem, so they don't need to treat that.
What I understand with it is that, one, children, they like to explore their environment. They like to explore the environment around them, and then for that, upper respiratory tract infection is more in them, and there is relationship between upper respiratory tract infection and the conjunctivitis, because there's communication between the eye and then the nasal cavity. So if you have upper respiratory infection can ascend through that connection and get to the eye. Then that's number one. Then number two, just as I said, the way I understand it is that, children, if they are teething, they tend to have like irritation around the site of teething. So for that, they always try to, use their hands to scratch that place.
Yes.
And then along way, they crawl in an open environment. Yes. They crawl, they go everywhere, they touch, dirty things, and then they ended up taking their hands into their mouth. So the second most common place where the children usually put their hands are on the eyes. So along way, they also carry those microorganisms and into the eyes, and then problems start from there. I feel that is explanation for that.
How is conjunctivitis typically treated, and what's the prognosis?
Okay, as I highlighted earlier,
Yes.
again on the treatment, the general approach, and then the specific. So for allergic conjunctivitis, I said we use anti-allergy medications.
And they differs, right?
Yes, they differs depending on the severity of the symptoms and also the types of symptoms that patient present with. So these two will determine what type of medication and how much medication you give a patient. Then for the infectious type, mainly the bacteria, you use antibacterial, of course, since we know the etiology is bacteria. So we use antibacterial medications. And those things, they are usually given at the hospital after assessment by an eye doctor. So it's an eye doctor that will assess, see what is best for the patient, and then recommend such medications to him. So at this juncture, I want to appeal to the general public that we should, as much as possible, try to avoid self-medication. Always present to the hospital, listen to doctor's advice, and also take doctor's recommendation.
Are there any complications if the conjunctivitis left untreated or mistreated or mismanaged? Like for the parents that will just say is eye problem, it will just after some time it will clear up. So are there any complications?
Of course, there are complications. A lot of them we mentioned before, ranging from corneal ulceration. The whole of the eye can get infected, and that eye is lost. We could have corneal scars. A lot of things.
What advice will you give to someone who has been diagnosed with conjunctivitis to manage their condition and to prevent spread?
Okay, well, I will advise them for you to know that, of course, you may have an idea based on the symptoms that you are likely to have conjunctivitis, but that will be confirmed only at presentation to the hospital. So if you are diagnosed with it, of course, some medications will be recommended for you and you use it. I think that's what you should do, not to self-manage your condition, because of course you may have an idea of the medication, but you may not know the substance of your condition. So, and that will only be found out on presentation to the hospital.
But are there any home remedies, like I asked you before, that people can easily use rather than being how will I put it? Rather than going to the hospital, because some people cannot afford these medications, and that's why some people stay at home and use the locally home these remedies for the treatment of conjunctivitis.
Well, we frown at that. We really frown at using traditional eye medications because those medications have not been scientifically proven to be effective, and some can even be harmful. So instead of you getting cured, you end up losing your sight, fully losing the whole eye. If you have a condition, if you have any eye condition, you can always go to the nearest hospital. In Sokoto City, notably Specialist Hospital, and then Udut Hospital. And for those that can afford, they can afford care. There are many private facilities where eye care services are also provided. So you can always lay your hand on one of them. If you give specialists, the services there are free. You don't need to pay anything. And most of these medications, if you look at it, they are not expensive. They are not expensive, honestly. Most of them are not expensive.
So it's affordable.
It's affordable. Most of the antibiotics that we use, all these anti-allergy medications, most of them, they are affordable.
Thank you very much, Dr. Amiru Abubakar Abdullahi from the Department of Ophthalmology, Usman Danfodiyo University Teaching Hospital. Thank you for honoring our invitation and for sharing your thoughts with us.
Thank you for inviting me too.
You're welcome, sir. And with this, we come to the end of today's edition of the program, Midday Vibes. On behalf of our production crew and our guest, Dr. Amiru Abubakar Abdullahi, I am Hajara Usman At-Tajri. Stay blessed until next time.